we're here at the IAS meeting in Kuala Lumpur. We're here with Steve Deeks, who is like an integral part of this conference, and you're leaving early, so we have to get this in. But you really did do a lot of good couching where we're at with the cure at the pre-conference, a message on the cure, and then you also did the opening ceremony presentation, which you said was your highlight of your career, and so far. We'll see how that goes.
An honor. It was a great honor to be asked to open the meeting. Absolutely.
Exactly. Well, I'll let you dig in. Just tell us about where we are with the cure, how we should be thinking about where we are at this moment. There was a lot of good analogies. You did one in the press conference the other day. I'd like to repeat that.
Okay. So, a lot of people like to compare what we're doing with the cure with what we did in antiretroviral drugs. Because the development of antiretroviral drugs, which were designed to inhibit virus from replicating, was a spectacular success. Mm-hmm. And a lot of people want to make the comparisons, and I think it's really relevant to what we're now doing with cure to what we did 20 years ago with treatment. So if you go back and look at the history of treatment, what happened was in the 1980s, we spent a lot of money on the basic science of HIV, trying to identify targets that we can go after with drugs. And this was at that time, this was primarily basic science, funded by the NIH and so forth. Once we had these targets, industry got involved and rapidly developed drugs that inhibited the virus from replicating. Mm-hmm. And then from about 1987 up until today, industry has been tremendously successful in coming up with a variety of different drugs that work. And so I think now we're sort of shifting now toward the same kind of approach, but rather going after virus that is free and replicating, we're going after this hidden virus, the latent reservoir.
That we know more about today. Yeah.
That we know more about today, but I actually think in terms of cure, we're basically similar to where we were in 1987.
Mm-hmm.
With
transitional.
Right, with the treatment stuff, right? In 1987, all we were doing is just sort of trying to figure out how the virus made people sick, where was it, how to count it, mm-hmm. how to find drugs that go after it. Today, we're doing the same thing with the latent reservoir. Mm-hmm. We're trying to figure out its biology. We're trying to figure out where it's hidden. We're trying to identify targets that we can go after. We're trying to get industry excited to come in to help. Mm-hmm. And so the meeting over the past couple of days has really highlighted this. That mm-hmm. basic discovery is ramping up. We're finding out a tremendous amount of information on where the latent virus is, where it's hidden. We're identifying new potential pathways to go after it. Mm-hmm. And we're getting companies excited to help.
Set us up a little bit, because there was this pre-conference meeting where there was 2 days of intense focus just on the cure, so to speak, and then there's those presentations will be given within the conference itself.
Yes.
So it's kind of a double hit, and we're all embargoing whatever we do here until after the conference has the chance to present all of those details.
Yeah. So I think in terms of the highlights of the conference from a clinical perspective, I'm a clinical investigator, right? There was a lot of really great basic science, but in terms of the clinic, we heard about an update on the so-called Mississippi case. Mm-hmm. I think most of us now believe that
it's real.
That's real,
Mm-hmm.
that this was a baby who was infected and is no longer infected, that a cure had occurred. We're not sure what the mechanism is. We're hearing intriguing possibilities that other children might actually also be heading toward a cure mm-hmm. on long-term therapy, and that's generally exciting. We heard an update on a bone marrow transplant that occurred in Boston, in which the use of a really aggressive approach to cure cancer may have actually ended up eradicating all virus in a couple of individuals. It's somewhat similar to the Berlin patient, mm-hmm. Mr. Timothy Brown, mm-hmm. But different. Mr. Brown required very special cells to be donated. The cases in Boston, these were just donated from, a typical person. Mm-hmm. And so that's great, and that sort of generates, some new understanding into how the virus persists and how we might cure it. But for me, the most exciting thing that was presented, or among the most exciting things that was presented, was a new drug, an HDAC inhibitor, being developed in Denmark, mm-hmm. Was presented. and in a small number of patients who have been on long-term therapy, this drug, panobinostat, when it was added on to a stable regimen, forced virus to come out of its hiding place in a way that we've not seen before. And that's key. It looked like it forced the virus to come out of its hiding place in a way that the immune system can recognize the virus and the hiding place. And so in theory, if that's happening, we may be able to come up with a way to get rid of some infected cells.
This is an anti-cancer.
It's an anti-cancer compound that what it does is it makes makes us, people, turn on their DNA so it's transcribed and it comes out. And some of that's going to be the HIV DNA, which is integrated in our own DNA.
Amazing. So you're here. I think that what you did at the opening session was really great. It kind of puts us in our spot where we need to be thinking about what we're doing, and you kind of did a big picture, which was really good. I mean, have you heard? You talking to me afterwards about the reviews. How did you hear the reviews?
Well, most people who go out of their way to tell you something, it's going to be positive. So the reviews have been good. I annoyed a few of my colleagues by being a bit too speculative. Yeah. But that was actually what I aimed to do. I really wanted people to think about what the future looks like.
Yeah, and one of the things I didn't want to mention or ask you about was the assays and so forth that we're going to need. There should be more assays that are going to be necessary to through the process of this cure, so to speak.
Yeah, one of the great advances in the early 1990s was coming up with a very reproducible, well-validated way to measure how much virus there was in the blood. Once that happened, drug development became very easy, or much easier. So we need the same thing now with measuring how much virus exists in long-term therapy, the latent reservoir. And that's a challenge because the number of cells that are infected are very, very small, and a lot of it's in tissue. I'm actually kind of hopeful that the host response to the virus may end up being the best way to do this. When we looked at the Berlin patient and when people look at the Boston cases, the level of HIV antibody levels goes down to almost undetectable in a pattern that seems somewhat unique when you're curing people. So I think that this is where the future is going, is that we may still want to measure the virus, but we also may want to measure something like the antibody responses to the virus as a way of determining what's left.
Some sort of a correlation by what?
It's a correlation. It's an indirect way, but it's an easier way.
Okay. Well, I know that you have to run and you have so much to do, but I really appreciate you taking the time to visit with us, as always.
I think I've done this every conference. Always happy to do so.
Yes, I thank you so much. Thank you, Steve.